What's the hardest part of being a physician? Is it the hours, the never-ending documentation, or could it be the shifting regulatory and financial landscape? Whatever element of our system is the source of your disillusionment, one thing is for sure: you are not alone in your frustrations. I'm Dr. Dwayne Jenkins, and this is my Oxford Talk. The New York Times recently reported that doctors are demoralized and suffering from a diagnosis historically applied to terminally ill patients. Demoralization syndrome classically describes the sense of hopelessness and loss of purpose experienced by those facing seemingly unsolvable health problems. For physicians laboring in what is increasingly viewed as a diseased healthcare system, provider burnout and dropout are increasingly visible symptoms of this syndrome. More and more physicians voice an inability to sustain belief in a broken system. While there is no single antidote to the problems of disillusionment and disengagement, the cost of ignoring the impact of demoralization syndrome on individual productivity and long-term career sustainability is immense. So what do we do? Well, here's what I can tell you after 20 years of practice as a cancer surgeon. Neither my MD Anderson fellowship training nor my UMass Amherst MBA studies prepared me for the career-sustaining work which today makes me my most effective as a cancer surgeon, resident mentor, and high-performance mindset coach. I learned these secrets the old-fashioned way, in the school of hard knocks. You see, I was what many of you may or may not recognize yourselves as: a yeah but employee, a work-obsessed, high performer with underdeveloped soft skills and limited self-awareness. Her numbers are astounding. Yeah, but his hard skills are legendary. Yeah, but they're a rock star when they're not drinking. Yeah, but you get the picture. It's easiest to recognize this in others. The challenge is to adopt disciplined self-care strategies which allow us to recognize it in ourselves. That's what I had to do. It wasn't enough for me to perform the first GYN robotic procedures in the state of Florida, or to travel the world caring for patients and training physicians on 5 continents. Like Dr. Thomas Stone, the protagonist in Abraham Verghese's masterful work of historical fiction, geographic change was no substitute for me embracing the hard work of self-reflection and acceptance. For the past decade, sobriety and meditation have been essential practices powering my personal transformation. In my coaching practice, self-acceptance and meditation are the pillars upon which sustainable change is built. I believe that physicians must embrace self-care if we are to maintain effectiveness as leaders of the healthcare system, and most importantly, empower our patients in their own self-care journeys. A disciplined approach to our physical and mental health needs is the way forward. Suffering in silence until one reaches the breaking point is clearly not sustainable, and frankly, it's not responsible. Our patients need us at our physical and emotional best. Whether we recognize it or not, we physicians are athletes. No one tells you this, but it's true. Just like an athlete, you'll be challenged to maintain high levels of mental and physical output over the course of your career. Unlike most athletes, your career lasts decades, so being disciplined about self-care will pay big dividends. So, how do we do that? My approach emphasizes meditation. Meditation is a versatile, portable, and easily adaptable vehicle for increasing focus and fostering sustainability. It is the gym that allows us to train and flex our mental muscles so that whether we're at the bedside, in the operating room, or in the boardroom, we can bring the power of deliberate intention and focus to our efforts. Not only should practicing physicians embrace this practice, we should be teaching it in medical schools and in residencies. There's a robust body of evidence supporting this recommendation. Meditation significantly improves memory capacity and the ability to sustain attention. It reduces stress, anxiety, and negative emotions by enabling one to experience them selectively and to process them differently. Mindfulness meditation increases the ability to focus attention and suppress distracting information. This benefit in particular has profoundly impacted my ability to perform complex robotic cancer surgeries, taking my existing knowledge and abilities and supercharging them. Less emotional reactivity. This one is especially important. Whether I'm operating at the end of a long week, having end of life conversations with my patients, or discussing tough issues in the boardroom. Speaking of the boardroom, some of the most successful companies and business leaders have published their experience with mindfulness practices in the workplace. More than one quarter of the Aetna workforce of 50,000 people has participated in a mindfulness or yoga class. Those who have report, on average, a 28% reduction in their stress levels, a 20% improvement in sleep quality, and a 19% reduction in pain. They also become more effective on the job, gaining on average 62 minutes per week of productivity each. Aetna estimates this is worth $3,000 per employee per year. Yet mindfulness is not just a grassroots exercise. Some of the biggest names in business embrace mindful leadership. These leaders have been practicing meditation for years and say mindfulness promotes maintenance of a beginner's mindset and encourages deep listening. Mindfulness helps these leaders maintain curiosity, empathy, and compassion. Now, a corporate meditation initiative cannot by itself overcome deeply rooted institutional problems, but both the individual and economic benefits of this practice are well established. In my own practice, I devote 10 to 15 minutes twice a day to meditation. I focus on my breath and offer no resistance to any thought or vocalization. I train myself to experience and observe the moment so that my intention remains focused and ready to exploit whatever circumstance, opportunity, or relationship is presented to me in that day. You choose whatever method works for you, with the assurance that neuroscience shows this daily practice boosts the prefrontal cortex, the area of the brain that regulates attention. In short, mindfulness as attention training is available to all and fully customizable. With physician dropout on the rise and the cost to train a new physician exceeding $1 million, we cannot afford to ignore the costs of physician burnout and demoralization. We must act now to ensure a healthy physician workforce that meets the needs of our diverse and growing society. Together, let's reimagine a way forward for your high-performing, yeah, but team members. Help your organization deal with the difficult choices while maximizing the investment you've already made. in human capital. Thanks for listening.